Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Surgical emphysema might sound scary, but understanding it can help ease your worries. It's basically air trapped under your skin, creating a crackling sensation when you touch it. Imagine pressing your finger on a bubbly packing material. It feels like that, but under your skin. This happens when air escapes from where it belongs, like your lungs or windpipe, and gets trapped in the tissues under your skin. Surgical emphysema is usually not life-threatening, but it needs attention to prevent complications. Doctors need to find out what caused the air leak and fix it. This could involve imaging tests like X-rays or CT scans. This article will explain surgical emphysema in simple terms, making it easier for you to understand. We will discuss its causes, symptoms, diagnosis, and treatment. By the end, you'll have a clear understanding of what surgical emphysema is and how it can be managed effectively. Air can escape into the skin for several reasons. This phenomenon, known as subcutaneous emphysema, occurs when air gets trapped under the skin. It can be alarming to see and feel, but understanding the causes can help manage the condition effectively. One common cause is surgery, especially after operations on the chest, neck, or face. During these procedures, air can inadvertently be introduced into the tissues. Post-operative care is crucial to monitor and address any complications that may arise, including the escape of air into the skin. Sometimes a lung injury can cause it. Injuries to the lung can create pathways for air to escape into the surrounding tissues. This can happen due to trauma or other medical conditions affecting the lungs. This could be from a broken rib or a puncture wound. Such injuries can compromise the integrity of the chest wall, allowing air to seep into the skin. Emergency treatment is often required to manage these injuries and prevent further complications. Certain medical procedures can also lead to surgical emphysema. Procedures involving the chest or respiratory system, such as the insertion of chest tubes or endoscopies, can sometimes result in air escaping into the skin. Breathing treatments with a mask or using a ventilator are examples. These treatments, while essential for patient care, can occasionally cause air to leak into the tissues if not managed properly. In rare cases, vomiting violently or forcefully can also force air into the chest tissues. This can happen when the pressure from vomiting is so intense that it disrupts the normal barriers, allowing air to escape into the skin. Recognizing and treating the underlying cause is key to resolving the issue. The most noticeable symptom is swelling under the skin. It feels like bubble wrap when you press it. You might hear a crackling sound too. This is the air moving around beneath your skin. Other symptoms depend on where the air leaks. If it's near your airway, your voice might sound different. You might also have trouble swallowing or breathing. If you experience these symptoms, seek immediate medical attention promptly. Section 4. Diagnosis and detection. Identifying surgical emphysema. Doctors diagnose surgical emphysema by carefully examining the skin. They'll press on the swollen area and listen closely for a crackling sound. This distinctive sound is called crepitus. Sometimes imaging tests are needed to confirm the diagnosis accurately. X-rays or CT scans can show exactly where the air is trapped. These tests help doctors understand the full extent of the condition. Section 5. Treatment and recovery. Managing surgical emphysema. Surgical emphysema, also known as subcutaneous emphysema, occurs when air gets trapped under the skin. This can happen due to various reasons, including trauma, surgery, or lung conditions. Treatment for surgical emphysema depends on the cause and severity. The first step is always a thorough diagnosis to understand the extent of the air leak and its source. If the air leak is small, it may resolve on its own. In such cases, the body can gradually absorb the trapped air without any invasive procedures. The doctor might just monitor you and provide pain relief if needed. Regular checkups and imaging tests can help ensure that the condition is improving. For larger air leaks, treatment focuses on fixing the underlying problem. This could involve more intensive interventions to prevent complications. This might involve surgery to repair a lung injury or adjust a chest tube. Surgical intervention is often necessary when the air leak is significant or persistent. In some cases, the doctor might need to remove the trapped air with a needle. This procedure, known as needle aspiration, can provide immediate relief by releasing the air. Rest and supplemental oxygen can help with recovery. Oxygen therapy can assist in the absorption of the trapped air and improve breathing. Additionally, patients are often advised to avoid strenuous activities to prevent further air leaks and to promote healing. UMCC, your ultimate medical consultant connectors.